This is BioSTL's first ever symposium on rural health innovation. The innovation that we can attract to St. Louis can be innovation that can benefit rural communities.
We at GlobalSTL, having spent some time with rural stakeholders and seeing how this can really move the needle, we decided to bring them here to see these innovations and go back and say, yeah, that's the model of care I want in my community.
This symposium is incredibly important to the sustainability and viability of a lot of the rural health providers across Missouri.
I want to be here because I want to know what other people are thinking about, what are the solutions that others care about.
I think that's exactly what BioSTL is doing. They're getting synergy around like-minded people that know the status quo will not work in the future.
The level of innovation, I think, would stand up whether you were in Silicon Valley or Boston or Chicago. I'm just really, really impressed with the quality of the presentations.
That's how we're going to advance the cause of rural communities and make sure that we provide rural solutions to rural challenges. Collaboration, collective vision, connection, and then cultivating what we have by listening primarily and foremost to our rural communities.
BioSTL and GlobalSTL have done a fantastic job of actually going out and finding people from around the world who have innovation and technology. Maybe they can locate a headquarters here, maybe they can deploy some of their technology here. They've been a leader in bringing that kind of resources to our region, and I think it's a natural step for them to say, hey, now, the next step will be, let's find the resources that we have and find out how we can deploy those in what we call rural healthcare.
What we hope to gain is have more insight, more knowledge into how to impact rural America.
I think we need to bring additional technology into the healthcare community, and St. Louis is a great place to showcase the healthcare capabilities.
T-Mobile's partnership with BioSTL demonstrates our commitment to Missouri, and especially rural Missouri. Our 5G network covers 3.2 million people who are living in small towns and rural areas.
I'm excited because there are actually tangible ideas that I heard today. Innovative solutions that are working in certain areas of the country that I'm hoping that we can explore here in Missouri.
And when we increase our telemedicine capabilities, we improve the health of our Medicaid participants because it gives them access that they would not have otherwise had.
If I could describe the BioSTL Rural Healthcare Symposium in one word, the word I would choose is community.
I'd say fascinating, great innovators that really care about this common need to better serve people in rural communities.
I'd say it's compelling. It's such a great synergy of literally all the things that are going on in the world.
I describe it as exciting because I do see it as a first step in really creating the type of change that's necessary and needed in rural communities.
We got to do a better job in rural Missouri of trying to provide services to them. And to be able to partner with the Bio St. Louis, you've got some of the world's best right here in this region of the state. We don't have to invent the wheel. We just got to take what we got here in the state of Missouri and figure out how do we implement it all across the state.
We have in this one venue people from the boot heel of Missouri to people from Israel and Portugal all coming together and finding ways for mutual benefit. That's what BioSTL has been about for 20 years.
I think it's great to look outside the border of Missouri to see what else has worked in other states and in other countries.
Those were the solutions I heard being talked about today, is how do you use technology, keep the personal touch so that we can truly make Missourians much healthier.
With all the efforts that are coming together, everything that everybody's doing, it's focused on everybody having that opportunity to have better health.
Our goal is to make an impact in every single county in Missouri through our outreach, education, and research that support healthcare.
If we are going to be successful in the 21st century, all of Missouri needs to be participating in the 21st century economy, not just the metro areas. And so this initiative is about building an inclusive 21st century economy for all of Missouri.